Hi, I'm Gabriela Voltaggio, and this is my presentation on specific phobias. What is a phobia? A phobia is an uncontrollable, irrational, and lasting fear of a certain object, situation, or activity. It can be caused by both genetic and environmental factors, which appeals to the nature versus nurture concept. It can also be caused by brain function or witnessing a negative experience. Specific phobias are fears of an object or situation that is not commonly harmful. There are many types of phobias that categorize multiple specific phobias. Some are more common than others, but they are typically categorized as animal type, natural environment type, blood injection type, and others. Phobias are most likely to develop in children, out of them as they grow older in age. But we are all born with two phobias, the fear of falling and the fear of loud noises. These are fears that humans and animals are born with as natural instincts for our survival. Here is a list of phobias listed underneath the category of animal types. These include the fear of dogs, snakes, insects, and spiders, which is the most common phobia, and there are also cats, horses, reptiles, birds, and zoophobia covers the fear of all animals. Here I included a video of a trailer of a movie that was created solely off of the fear of spiders, which is arachnophobia. I'm going to save the video at the end because I don't want to run out of time, but this was just to demonstrate how this fear can really affect somebody, and it was also created in the sense of a horror movie, which, reenacts how it feels for someone with arachnophobia to see a spider or be around one. The next category that I'm going to cover is the natural environment type. These phobias include the fear of heights, the fear of lightning and thunder, fear of snow, fear of sun, fear of hurricanes and tornadoes, fear of the rain, fear of gravity, fear of bacteria, water, dirt and germs, and the fear of the dark or the night. This is an educational video on acrophobia, the fear of heights. It is a very common phobia, and as I had mentioned, we are all born with it to help, our survival. But this kind of just talks about more in depth what people with acrophobia go through and how their perception changes. If I have time at the end, I'm going to come back to it. The next category is blood injection types. Now, unlike the first two categories, this one does not include specific phobias. So just as the other ones had specific phobias for each fear, this one only includes blood injection injury, also known as BII. The next category is situational type. This includes fears such as open spaces, fear of riding in a car, needles, fear of clowns, fear of accidents, fear of holes, and fear of flying. Fear of holes is also a common fear. This can be categorized as natural environment since there are holes that are naturally created. It could be under either category, but it's most commonly used under situational type. There are many other phobias that fall outside of these categories. For example, there are many social phobias. This includes the fear of people or society, fear of being touched, fear of imperfection or failure, fear of speaking in public, fear of love, fear of social evaluation, and fear of strangers. There are many more, and I most recently learned that there is a phobia for the fear of women and for the fear of men. This was something new to me that I found very interesting, that it was an actual classified phobia. The phobias are quite a disturbance and an annoyance in one's everyday life. However, it does not need to be notified by a doctor unless it is a serious disruption in everyday activities, such as school, work, or even at home. There are physical and emotional symptoms a person feels when they have a phobia. The physical symptoms include increase in heart rate, feelings of unsteadiness and dizziness, feeling faint, drop in temperature, heart palpitations, and chest pain. There's also a lot of sweating that most usually occurs on the palms and the hands. A person with a phobia will experience an immediate feeling of intense fear and anxiety and panic when exposed to or even thinking about the source of the phobia. They can also recognize that their fear is unreasonable, but they feel powerless against it. This anxiety will worsen as the object or situation grows nearer in physical proximity or in time. Common misconceptions about phobias are that people who have them are crazy. Even though phobias are extreme reactions over little unnecessary situations or objects, they are a legitimate psychiatric condition. Phobias are not serious. This is also false. Phobias are extremely distressing and cause an impairment in a normal function. They are linked with extreme biological and psychological fear response. Phobias cannot be overcome. This is also another myth because they can be treated and overcome with hard work and persistency. Phobias are genetic. It is true that some phobias can be learned off of observing a parent's behavior, but there is no proof that phobias can be genetically inherited. Treatments for phobias. The most common treatment is cognitive behavioral therapy, but medications can also be used to help one deal with their phobias. Cognitive behavioral therapy, also known as CBT, is a certain type of counseling that is designed to change the way of thinking and behavior. It is used to develop practical ways of dealing with a phobia. A big element within the CBT therapy is exposure therapy. This can be done with slowly incorporating parts of the phobia and exposing it to the person in a harmless manner. An example of this would be somebody struggling with the fear of snakes. The way the CBT therapy would work is they would start out with having the patient just start reading about snakes and getting familiar with them. Then, after that, they might graduate to showing them pictures of snake to help them get over the visual fear of seeing a snake. After that, then they might graduate to going to a museum and watching a snake, but no need to fear them since they are behind the safety of glass. If the patient is excelling with all of these exercises, then the next step would get to hold the snake. This is a gradual and effective way to overcome fears without needing any medication. The medications that can be used, though, to help solve phobias are antidepressants. Antidepressants are medications that are used to reduce anxiety. They are oftentimes prescribed to people who are diagnosed with anxiety, social phobia, or panic disorders. The medications that can be found within antidepressants are escitalopram, sertraline, and paroxetine. There are, however, many side effects that can come from these medications, and they cause some pretty dramatic withdrawals when the patient has to suddenly stop ingesting them. Another medication that is commonly used are sedatives. Sedatives are also referred to as tranquilizers, and they're a group of medicines called benzodiazepines. These are used as a relaxant to reduce anxiety. It contains a medicine called diazepam, also known as Valium, and this is used at the lowest possible dose, but it can also be super addictive and must be used with caution. Another medication that's commonly used are beta blockers. They are used to help people who struggle with phobias because they help block the stimulation of adrenaline. And adrenaline is what causes the heart palpitation, increase in heart rate and blood pressure, the sweating, the nerves, the anxiety. So blocking the stimulators for adrenaline will help reduce all of that, lower the heart rate, the blood pressure, and shaking limbs caused by anxiety. These are all of my resources, and I will go back and watch one of the videos since I have 2 minutes left.
No way I'm going up there. What? No. Why is it some people are afraid of heights, but others aren't? A fear of heights could actually be a good thing. It's a sign we've adapted to the world around us. A normal fear of heights is considered to be an evolutionary advantage to keep us safe from a dangerous fall from a height. Infants and young children are naturally cautious around heights, suggesting it's an inbuilt mechanism that we are born with. Now, this is the normal uneasiness around heights that most people feel, not the phobia that some people experience. A phobia of heights, called acrophobia, is far more serious. It could be an unconsciously learned response due to a traumatic experience such as a fall, or even learned off a parent. It is essentially an extreme protective mechanism. Acrophobia is not the same as vertigo, which is caused by the eyes trying to focus on an object a long distance away. This causes the head to sway imperceptibly, which the body then joins in on, creating a whole body wobble. If a person's sense of balance is affected, it increases the chance of falling.
Unfortunately, this is all the time that I have. Thank you